Speakers. So first, we have Lisa Mansfield, PhD RN. She's an assistant professor at the UNC School of Nursing and an associate member of the Weinberger Comprehensive Cancer Center. And her work is dedicated to advancing equitable access to cancer screening and increasing uptake of preventive services, particularly vaccination, in marginalized and underserved communities. She employs a community engaged approach towards addressing the social determinants of health that contribute to HPV associated cancer disparities. Dr. Mansfield has led multiple studies examining parental decision making and the impact of social determinants on HPV vaccine uptake in adolescents. She is also committed to co-developing interventions with trusted community partners to expand access to cervical cancer screening in rural communities through HPV self-collection methods. Our second speaker is Savannah Carson, PhD, who's the Director of Community Research within the Community Engagement and Research Program, or CERP, of the CTSI here at UCLA. She works to initiate and facilitate community academic partnerships for health improvement through research education, the development of community advisory boards, and the promotion of diversity and inclusion in research, community engagement, qualitative methods, and policy development. So take it away.
Thank you for that warm introduction. I'm excited to be here with Dr. Carson today to share some of the virtual qualitative methods that we use for our multi-ethnic focus group project that we conducted during the pandemic. I do want to preface today's presentation to acknowledge that though the presentations heavily focus on the methods that we use in our project for these focus group interviews, there are some aspects of the methods that we'll talk about today that are applicable to qualitative methods more broadly. So just a quick overview of today's presentation. We'll review or re-review the disparities in COVID-19 cases and vaccination. We'll then talk about how we designed our study and the methods that we use to conduct the multi-ethnic virtual focus groups. I'll then switch it over to Dr. Carson, who will talk about how we as a team conducted qualitative interview or qualitative analysis virtually. We'll present some of the study findings, but we won't spend as much time on discussing that today, but happy to take questions about what we found related to our themes from the analysis. But we will spend a little bit more time talking about our rapid dissemination of our study findings and how we did that across various sectors. So as we know, COVID-19 disparities looked very different for many different groups during the pandemic. And a lot of these disparities in COVID-19 outcomes were stemmed from structural factors such as structural racism and socioeconomic disadvantage. And if we go back in time in 2020, which I know most of us don't want to do that, but if we do look back at the disparities that occurred in COVID-19 cases in the state of California towards the end of 2020, we see that Los Angeles County is among other counties in Southern California that saw significant cases in COVID-19 during the pandemic. And these particular cases were significant because they highlight disparities where there was cases and death rates that were at least twice as high for high poverty areas and racial and ethnic marginalized communities during that time. And when we looked at the disparities of COVID-19 cases and vaccine allocation between 2020 and 2021, we see here that there were areas within Los Angeles County that are have high cases of COVID-19, yet these same areas saw the lowest vaccination rate uptake. So we see here that the hardest hit areas had the lowest vaccination rates, further driving those disparities in COVID-19 outcomes. So because of these disparities that we saw early on, our team was very interested in wanting to understand factors contributing to vaccine hesitancy, how people made decisions for vaccine uptake, as well as whether they'll be acceptable of COVID-19 vaccines among high-risk multi-ethnic groups within Los Angeles County. And so we use community engaged methods not only to inform our study design, but we consulted with our community partners to let us know what would be the best recruitment methods to find the people we were interested in interviewing, as well as getting feedback from them as well on our methods and dissemination plan. I will say overall in qualitative research, you may hear the word epistemological or epistemology. That's just a fancy word that means you need to have a point of view in which that you feel that your study design and qualitative methods align with, so that you're telling the story of your qualitative findings correctly. So for us, we aligned our epistemological view with the critical, realist, and radical paradigms. And this acknowledges that one's culture and experience of structural and systemic barriers can shape their reality. So we kept that in mind as we were interpreting and analyzing our findings. But there was also other important context during the pandemic that we had to be considerate of. So, as you know, during this time, there was high mistrust of the government and also of sharing of information. Back around this time when we started our focus groups, there was a new president. It was the start of the pandemic. COVID-19 vaccines became highly politicized. And there was a lot of contemporary and historical medical mistrust and mistreatment, including following the steps of the George Floyd murder that happened just 6 months before we started our actual project. So we had to take those into consideration and how this will shape our participants' viewpoints as well. We also had to acknowledge the fact that by the time we did these focus groups, the COVID-19 vaccine was rapidly developed. So many people were skeptical that there were skips or steps that were skipped during the clinical trials. And we had to acknowledge the hard economic hardships that the COVID-19 pandemic had on the community, particularly in high unemployment rates, or putting those such as essential workers at higher risk for COVID-19. So, another obstacle we had to overcome was doing this research in a rapid timeline. And so, we did 2 hour virtual focus groups between November 2020 and January 2021. In total, we did 13 focus groups across 70 participants. Now, if we go back in time, though, what was going on during that period of time? So, as I mentioned, we started our focus groups in November of 2020. Shortly thereafter, Pfizer and Moderna vaccines received EUA approval, and vaccine eligibility was open to healthcare workers. We quickly finished our focus groups late January, but shortly and around the same time, LA County also opened vaccine eligibility to individuals over 65. And then shortly thereafter, once we finished our focus groups, Johnson& Johnson's vaccine was approved for EUA approval. So as you can see, at the time that we were conducting these focus groups, there was lots of changes going on with the COVID-19 vaccines rollout, and also this information coming out about the vaccines available that can shape our participants' views and concerns about the COVID-19 vaccine. And so, with recruitment and screening, we were particularly interested in populations that were at high risk for COVID-19, particularly those community members in LA County. So, this included essential workers, racial and ethnic groups that face high burden of COVID-19 or related comorbidities, those living in low income, high poverty zip codes. And when possible, we wanted to select areas that had community leaders who had broad connections and insights of what community members in their communities thought about the COVID-19 vaccines. And here to the side is just an example of what our recruitment flyer looked like. And so, as I mentioned, we did use community engagement as part of this project, and they did help with recruitment. So, we were able to partner with community-based organizations to do outreach for recruitment. And this included making sure that we weren't just going into the communities to say, hey, help us out and find these people, and then that was it. And then thank you for your time, and we'll pay you for that. No, anytime you do community engaged research, you want to make sure it's a reciprocal relationship. So we quickly acknowledged that while we were asking these community-based organizations for help in finding the population of interest, we had to give something back to them. So we made sure that our research outcomes aligned with what would be beneficial to the CBO's mission and planning for COVID-19 education. During this time, they were scrambling, trying to find trusted and reliable information to share with their community. So partnering with an academic institution like UCLA was a great reciprocal relationship to be able to give them back information that's driven from the community members that we interviewed. We also focus on direct outreach to the CBOs that were serving essential workers and multi-ethnic groups to make sure that we were truly reaching the communities that needed this information the most. We were able to screen for eligibility using a Qualtrics screener. And then, oops, I can't see my last point. Many of the participants that we did end up recruiting were from underemployed groups. And so for our focus group interview, our focus group guide, we developed this using previous vaccine literature and also discussions with our community partners. And so, yes, we started with an icebreaker, but I think it's generally great for any qualitative project that you do, whether you're doing focus groups or even individual interviews, to always start with an icebreaker because this helps to promote comfort among your participants as well as the moderators to be able to want to answer questions. You never want to start with a heavy loaded question and expect your participant to open up right away. So for us, we were asking particularly how people were feeling about the pandemic and asked them one word to describe their community. We then followed up with a question of like, what have they heard about COVID-19 vaccines in terms of protecting against COVID-19? And that allowed us to hear some of the either misinformation or correct information that was spreading around in the communities. We then moved into the different COVID vaccine domains. So we were interested in participants' concerns about receiving the COVID-19 vaccine, any risk that they may foresee or benefits. We were also interested in where people were getting their information and where they would like to receive their vaccination, as well as barriers to getting the vaccine and any recommendations to improve access either for themselves or people they know in the community that may have a hard time getting access to vaccines. And so, in addition to asking about the concerns and challenges about the COVID-19 vaccine, we did also give them a situational question where we're highlighting that the COVID-19 vaccines were being tested because at the time they had not rolled out yet, but they weren't going to be 100% effective in preventing infection. But highlighting that it was severely or significantly reduced their risk of severe illness and asking them how they felt about that. So that was another way of us being able to get at how they felt about the vaccines in terms of being accepting of them once they came out. And then lastly, we were interested in solution focused discussion. So we wanted to know what would make people in the community, especially in the multi-ethnic focus groups that we did with the community members, make them feel more comfortable in receiving the COVID-19 vaccine, and what would be the best way to give it out to people once it became available. And so, when doing the virtual focus groups, there's lots of things to consider. As I mentioned, you want to always start with an icebreaker just to kind of build rapport and relationship among the participants as well as the moderator. But you also want to make sure you're encouraging diverse voices and opinions. Reminding people that we're here to listen to them and we also want to hear from everyone. Sometimes in a group, people may feel like they want to give the right answer, but there really is no right answer. The right answer is just their perspective and opinion about the given topic, in this case, COVID-19 vaccines. And you may have sometimes when you may have what we call the monopolizer of the group, which is the person that is answering all the questions, and may have some people in the group that aren't participating that much. So we always want to encourage everyone. We want to hear from them. And I know in our particular focus groups, we actually called on people that we noticed weren't participating just to give them a chance to speak out if they felt a little uncomfortable or a little timid to actually raise their hand and speak. We also wanted to highlight why their broad expertise is needed. Many communities feel, researchers just come into the community and take what they need in terms of data, and then we leave, and that's it. There's nothing from them other than that. But we were intentional of making sure the focus group participants knew that we were considering them the experts because they are the experts of their community, neighbors, families, and friends. And so we wanted to hear their thoughts and concerns that only they had insight into their community of. And it's also important during this time that there may be instances where people want to share personal information. They can do that. We have methods in which we de-identify the transcripts when we go ahead and transcribe these interviews or the audio recordings. But if there's someone that wants to share something personal, but they don't feel comfortable doing so, they could share maybe a situation or situational type of example. So here we have someone who may have said, I want to share that my brother has a mental illness, and this may create an obstacle to getting the COVID-19 vaccine. But if they didn't feel comfortable saying that, they may say that people with mental illness may have trouble getting the COVID-19 vaccine. So that's a way that they can share personal information without relaying too much. It's also important to have privacy options and reminders. So, not only to respect everyone in the group and their privacy, but also reiterating that this is a safe place, but also we have the IRB and different HIPAA things that we have to consider. So it's important to reiterate not to share any personal information of others on the call, as well as having respect for others with different opinions. And that has happened plenty of times in our focus groups, but encouraging that the goal of the project is to get different perspectives. So it's okay if we don't all agree. We want to hear what different perspectives and views are of this topic. And then lastly, unique to our focus groups, we wanted to make sure we kept a community specific focus. So we intentionally stratified our groups, not only by racial and ethnic identity, but we also did it by age as well. So we had different racial and ethnic groups, as well as stratified by under 50 and over 50 to have representation of younger people and older people's voices about COVID-19 vaccines. So, in conducting the virtual focus groups, as I mentioned, we had different racial and ethnic groups. So, it was important that the moderators also reflected those groups as well. So, for the most part, I believe most of our groups had a moderator that was either from the racial and ethnic identity themselves, or at least were close proximity to understand different diverse perspectives among these groups. And this was a pro of our focus groups because we wanted to make sure that we had representation of the communities that we were interviewing amongst the facilitators themselves, but it was also great for the facilitators to understand cultural and linguistic nuances about COVID-19 attitudes, beliefs, and concerns. However, a con of this was fidelity. So we wanted to make sure that across the groups, all of the facilitators or moderators were doing the same thing and across all of the groups and doing the same types of question techniques and all of those things. So to combat this, all of our facilitators had to do multiple trainings, and then we had one person to be an observer for every group just to make sure any follow-up questions or what we call probes were being asked in a similar way. We were maintaining quality of how the interviews were being, our focus groups were being conducted, as well as making sure we were staying within the time limit for each focus group interview. And then the participants, as I mentioned, were encouraged to contribute as individuals that were living in these high risk communities, as well as experts on behalf of themselves, families, and their communities. Something we really had to navigate was, I mentioned, we started this in November 2020. So as the world was rapidly like changing to Zoom, we had to acknowledge that Zoom for some was new and it was a new skill. So we allowed some of our participants to call in on landline instead of the Zoom call if they had to, and also called out to some participants if they were having trouble accessing the getting onto the groups. We also offered physical mailed gift cards or electronic gift cards for their participation. And I also want to highlight with doing virtual focus groups, there is an added nuance of thinking about some of the logistic barriers that sometimes can come up when we ask participants to come to us, and i.e., us could be on campus or wherever we ask them to meet up. It does alleviate some of those barriers related to cost for parking, childcare, if they have to find someone to watch a child or even elder care. So there are some benefits to that, but then there also are some cons in thinking about we're assuming everyone has access to the internet and has a smartphone to be able to have these interviews. So just as some pros and cons to weigh out when you're considering to do virtual focus groups. And we did our focus groups in English and Spanish, which was a limitation because, as we know, in Los Angeles County, there's a diverse array of languages. So we were limited to just those groups. And so, as I mentioned, we did 13 focus groups. We had roughly 4 to 6 participants per group, which is usually an ideal number, what you want to have in a focus group, because any more than that can be too many voices in the room. And it's also sometimes hard for the facilitator or moderator to make sure we're getting everyone's perspectives. So, that's usually a good amount of people to have per group. And as I mentioned, we stratified by age, under 50 and over 50. And these were the different racial and ethnic groups that we conducted focus groups with over 70 participants. So, of our participants enrolled, 56 were residents of high poverty zip codes, and about half were essential workers at the time. And so we were able to have representation of the populations of those who were most affected by COVID-19 and were least likely to receive updated information, have structural barriers to accessing vaccines, but we were able to learn of supportive recommendations that would be needed to improve equity to vaccine campaigns. And with that, I'll turn it over to Dr. Carson to talk about virtual qualitative analysis.
Thank you, Dr. Mansfield. Um, so as you saw, we did 13 focus groups in about 2 months and less than that with the holidays. And within that time, we met Lisa actually as she was a fellow at NCSP. So she conducted, I think, 2 out of the 3 Black African American focus groups. But with that, this was a new working relationship with Lisa, as often happens in academia, trainees and fellows. And we were trying to do rapid analysis to really feed back into public health groups and thinking about vaccine outreach. Also, our apologies for giving you any reflective PTSD on COVID. As Lisa was going over the slides again, I was like, wow, this is really a throwback at this point. But because of the new relationships, also having to do this on Zoom, I mean, honestly, the year before we would have done the focus groups and the analysis in-person meetings. So this really was a shift. So because of that, really working through best practices in analysis for documentation and thorough thinking throughout this project, but also wrapping our head around and creating a mind meld around 13 focus groups with 70 participants, it is a larger qualitative study. So I'll go through some of our best practices and of what we sort of worked through in that time. And really first, Lisa and I built our shared mental model and the entire research group around the Braun and Clark's methodology, which I love. It's the 6-phase reflective thematic analysis. It's a very highly cited reference. They have multiple references. Their latest is 2021, where they've updated their work. And I'm going to just go through a few points on this so you can take into account our context for analysis. So really, themes are conceptualized as patterns of shared meaning underpinned by a central concept. But what does this mean? So the core functions are that coding is active, flexible, and organic, whereas typically a code book is more prescriptive or you may not want it to change. So really, this does not mean that coding isn't structured. It just means that your coding scheme can and will evolve, and it should. You're becoming one with the data. And that, themes are not generated through the coding process after deep data understanding. The themes are generated. These are not found. So this is really recognizing the human aspect and the human function in qualitative analysis. Themes are not topic summaries. They're not your actual question to your participants. They're an answer to your hypotheses. So for instance, a theme name that doesn't tell you the answer would be vaccination challenges. It's simplified. I don't know what those challenges are. I don't know how it answers my question. But for instance, something like the burden of vaccine schedule on caregivers or families, which is something that we heard about having to go back and get a second shot and things like that, especially for caregivers and families and going on the bus with multiple kids and that kind of thing. Okay, so what is this six-phase reflective thematic analysis? It's familiarizing yourself with the data, systematic data coding, generating initial themes, developing and reviewing themes, refining those themes, and producing a report. Simple enough. So now let's get into coding within a team and as one code. And I'll go through those steps a little bit more. I'll kind of show you those in practice and how Lisa and I did those. So more to come on that in a minute. Um, so thinking about coding within a team or solo, there's pros and cons to both. There's also written in the literature about pros and cons to both. But really both need a lot of reflection and thought, and they can both having just one person or multiple people on a coding team, they both can lead to ruts, or you can get in assumption loops, or you can get stagnant, or they have variable timelines. When you're alone, you can work on your own timeline. When you're working in a group, you're really working on a dependent time where you're working together and thinking about things and making sure you're coming back to each other throughout that analysis. So, um, and I would argue that both need routine meetings with your research team, anyone that conducted the focus groups, any of your partners, to make sure that along your analysis, you're not getting too far away from the actual data and what people heard, and getting some reflection points. Oh, well, you missed this, or are you thinking about this? Or what I remember was this really important thing, and making sure that you're still sticking through to what sort of how the initial perceptions as well as being true to the data ongoing. So there's lots of ways to work separately and together in analysis, no right way, but all require transparency and quality improvement. So we'll kind of talk through how Lisa and I did that throughout. So taking apart step one, really what this is I always say it's like reading your transcript like a book. You're not trying to notate too much. You're not trying to code yet. You're just really trying to take it all in and get a outline and thinking of what are you hearing in each of these transcripts. How do we digest it all? What are common things that are coming up? What are uncommon things that are coming up? What's new? What's nuanced? And then many, many meetings in between Lisa and I and conversations and thinking about this and building out these initial concepts for starting a coding scheme. We also, as I said, involved the focus group facilitators who weren't part of the coding team, and also reflected with community partners in lots of meetings and along the way. And then I think it's really important in this phase, especially early on, to really respect different viewpoints from the group and the data, not just the most common or the most interesting. Really, the nuance is exciting and pay attention to it. I think that that's a common mistake when you're first diving into qualitative analysis, is you can really focus on the most exciting thing in the room and may miss the interesting nuance or the outliers. So here, this is in practice, and this is before going into qualitative software. So we first have our Excel start of our coding scheme. We have some notes here. We have some thoughts on what we're hearing. And then a month later, we have a more defined map of what we're hearing, and we're thinking of categories that these are in. But we've also, at this point, spent a lot of time on the code definition. And I think this is an under-recognized tool for qualitative analysis, is really improving and perfecting your definitions. And why those can be so useful is because they really help, especially in a team or by yourself, they really help to make sure that you know what each code means. And making sure that each code can stand apart, isn't vague, makes sense, and any overlap with other codes is very clear and defined, that Lisa and I can understand what we're working towards, and we know how to code once we actually start the coding process. So this sort of evolution is really important before you actually get into the coding. And this is why Braun and Clark really talk about the coding scheme changing and evolving. Okay, systematic data coding. This is the actual coding process. Really, this involves coming together and discussing your work, evolving your codes, documenting and memos, having reflections of what's actually happening, what are you hearing, and then really questioning, oh, what are we missing in our coding scheme? Or what is more important to pay attention to? What do we need to add? What do we need to take away? What do we need to combine? What are we not using that we thought was important, but is actually really not that important, or very much an outlier just because it was interesting? So really needing that double checking process. So what this looked like, and first, let's get into best practices in coding. This is within Atlas now. So we have a clear code name. We have a code definition and examples and exemplary quote. So this code was about people's concern about their safety about not getting COVID during getting a vaccination. So, kind of an interesting concept, but there was actually all these huge vaccination campaigns at Dodger Stadium, Disneyland, even going to the clinic. There's crowded lines. I remember getting mine, and there was every seat in the waiting room was taken. So, especially if you're very vulnerable health wise or concerned about COVID, or people concerned about people not wearing masks. This was a concern for people. And so there's even an example quote, and then there's really clear definition. And then there, even in the code name, there's asterisks for during. So it's very clear, making sure that Lisa and I have cues as we're going through transcripts and coding, we know what the code means. Okay. And so here actually is once we started in the software, our evolution and notes to each other that we would meet about every week or a couple times a week to think about how our codes could be improved. So you can see our dates and how we sort of evolved things. And even we added a few codes, our coding, or we combined a few codes, or we renamed codes. We just made things clearer and more specific as we went, and more comprehensive of the data to being true. And you can also see how we edited our definitions. And then it was also really helpful, especially working virtually, to kind of think about where each other's at and what we've added or changed. But also, these bullets get much less as you scroll down. Within a few weeks, we were in a very, very good place with our coding scheme. We knew where things were, and we weren't having to veer from it or think about what do we not. We were much more confident in our coding scheme. I'll say that. Let's see, where are we doing on time? 3:42. Okay. So this is a longer quote, but a few things here, and I'll just read a quote just to kind of give some context. But this was a Latino participant, and they talked about needing a COVID awareness campaign, even though they were in the middle of a pandemic. They talked about construction workers around their house that don't wear masks. They didn't really know how to wear the mask. The other said the mask was suffocating him because it's hot and they're doing construction work. So how to enforce that, and then how to do those campaigns. So something like, if I protect myself, I'm protecting you. If you protect yourself, you're protecting me. So sort of how to make it community congruent, why it's important. And then they also talked about the homelessness. We protect ourselves, but they don't have protection. There are people that are just sailing against the wind. There's no fairness. There should be a way to educate and reach out to those people in their own environment, in the places they live, in their subculture. They should be counted as part of the community to protect us all. So lots of beautiful aspects here, and you can kind of see that, there's so much here. But there's, community barriers and complacency. There's cues to getting, campaign cues that they would recommend what might help them or their communities understand the importance of a vaccine. Their preferences for improving equity, their worry over differential treatment, and the various populations that might be more vulnerable to COVID. There's a lot here. So just seeing that in practice. And then also, I would argue that there's an occupational hazard. Masks are very tricky in occupational settings, and so there's even more layers here we could dive into on another day. But yeah, so another way that you can allow for flexing flexibility and evolution in your coding scheme is using some other buckets. I almost didn't want to put this slide in because I really don't want people using it as a crutch. But for those that are new to qualitative research, I just want you to use this with caution. Here's our coding map. And we have these things with colons: barriers, benefits, preferences, cues, severity. This is the vaccine hesitancy model. And it's through the WHO and CDC, but barriers to vaccines is in the red, benefits to vaccines, what they see as benefits to vaccines, preferences for how vaccination should occur, cues, what would make you get a vaccine, disease severity, how that might motivate you or change your opinion. And then we had a susceptibility to the disease, and then their own culture, because we were doing racial and ethnic groups, so we often had to think about how that was showing up in different groups. But the things in blue are these other buckets. So we had other buckets in each of these sections in case we came across these outliers. And because it was such a big study, we use these to sort of capture anything. Okay, here's an outlier. Let's come back to this. But I think Lisa And every week or so, we'd go through those and see like, hey, I put this in this other bucket because I just want to come back to it. And I want to talk through it. And does it go somewhere else? So, just use them with caution. They should not really be a crutch for a bad coding scheme. And if you're using them too much, it's probably time to evaluate some of your codes. Okay. And the other way we sort of double checked each other and thought about quality improvement with each other was using these analysis tools. On the top is the racial and ethnic group. And you can see what I've circled is how many focus groups we had. So we had 3 American Indian, 3 Black, 2 Filipino, 3 Latino, and 2 Pacific Islander. So also from the top, we don't even have an even number of focus groups per group. So that's important to be aware of. One reason that, one of many reasons why you don't want to focus too much on the numbers, but that these counts can be really helpful as well. And then on the left, we have all of our codes. So you can kind of see across groups, oh, where are things coming up? Where are they not? And then, it helps us say, okay, well, why isn't child and elder care coming up in these other groups? Let's go make sure that they just didn't come up and we missed it or things like that. But it does help for some quality improvement here or there. And I think something that's really interesting is that, a language barrier only came up twice in the Latino focus groups, for instance. But in Filipino groups, it came up 12 times. So believe me, we went back and checked all the groups for language. And it was just that, it might have been that we were doing the focus groups in Spanish. It might have been that they had, clinic and providers that really had great Spanish translation. We didn't ask about language specifically. So there's a million reasons. We just generally asked about barriers. So there's a million reasons you can have a chart that looks like this. This isn't meant to be quantitative. It's just a great way to double check. And then, your quotes can sometimes be a half a page long or one sentence. And so the quantity doesn't equal quality or depth or reflection. It's just a way to double check. So more on that here. Okay. I think I need to keep moving here. Okay. So just some best practices: have routine conversations, questioning each other, use your memos, write down your reflections. Also, very much recommend a memo on discussion points throughout. You get these great ideas early on, oh, well, this is important. This could be a really good policy recommendation, or here's things that are coming up. So not only a memo on methods, a memo on, coding scheme, a memo on reflections or discussion is also really, really helpful. And then remember to dive in and out throughout, not just the most obvious polarizing or critical point of feedback, but focusing on those nuances, because they're also people's voices and opinions. And then when all else fails and succeeds, what's not working, go back to the data. Reading your data and understanding it is really, when you get stuck, the most important thing you can do. We also kept memos on each racial and ethnic group. Things that you didn't see in that coding scheme as much, but talking about the undocumented and access to vaccines, or, for instance, in the circle, the second box, I have a great quote about, Debbie Holland being a really nice role model for the American Indian community for vaccination, and wanting to see a vaccine campaign around people they trust like her. So, we kept a lot of notes to also think about that throughout, which was this whole other layer. Okay, themes. We just talked about coding, but themes, you're taking a step back. You're making these coding maps, you're revisiting your names and definitions, and you're regrouping and assessing with broader teams and partners. So again, this was our coding map. How do we take all this and make initial themes? So that you can see some evolution here, where we originally just had a basic list. And then some people like maps, some people like moving things around, or Post-its or things like that. I really like tables. I think they end up being really useful for your manuscript anyway. And you can kind of see things as a whole. You're having to write this big narrative on all the themes with your definitions, but the tables is, I find, really useful, a way to kind of see, oh, how are we making sense of all this? So how these themes evolved, and then eventually you see, very, very succinct but explanatory and clear themes. Okay. And then considering your themes, what did we hear, see, and read as a whole? How can you encapsulate all your codes and your findings in the essence of the data meeting? How can we comprehensively cover all the data and all that's being said wholly, truthfully, and clearly? So really having those questions as you go through your themes. All right. And producing the report. How do you combine all of this in a narrative form? How does it come together? What isn't flowing? What is? What pieces are fitting? What's missed or not being reported? I think that's one of the most important questions you can ask sometimes. And then, how can you be more clear in your language? Oftentimes we think we're explaining what we're hearing well, and then I'll pass it off. And then Lisa's like, well, what do you mean by this? So having that back and forth, making sure it makes sense. Okay, and I'm going to pass it on, Lisa, to actually how we did this part in real life. Yeah. Thank you,
All
Lisa.
right. So as Savannah mentioned, this is on a larger end of a qualitative study. So there was a lots and lots of data. So we had to get creative on different ways to disseminate this information, but also thinking about what was going to be needed for a public health emergency. So all of our focus group findings reflect vaccine questions, concerns, myths, or community-driven solutions to improve vaccine access and reduce vaccine disparities. And so we did this across 5 different sectors. So peer-reviewed journals, we did a community engagement by tailoring COVID-19 information and outreach and education that the community-based organizations said they needed for their communities, that they can provide to trusted messengers such as promotoras, community health workers, or other trusted messengers like faith-based leaders. We also sent this information in pretty quickly to public health agencies across the state of California as well as Los Angeles County, but then also thinking about those community-based organizations who were working as frontline workers to help combat some of the misinformation that was going on about vaccines. We also develop a policy brief and then also outreach strategies for the Get Out the Vaccine program. And I'm going to dive into each of these in the next couple slides. So, keeping in mind that we had different groups in this particular project, we had to be mindful of how we were going to stratify our group analysis. So, one way that we did this was we first reported an overall paper with all of the prominent themes shared across all 13 racial and ethnic groups that highlighted vaccine benefits, concerns, and challenges that was driven by the vaccine hesitancy matrix. So you can use theory throughout to even organize your findings for some qualitative results, but that's what we did for the larger paper. But then we, as Savannah showed in her slides, we did see that there were some nuances that were coming out in some racial and ethnic groups that were specific factors and considerations that weren't identified in others. So although we did all of this qualitative analysis, when we came down to identifying those specific racial and ethnic factors and considerations, we had to dive back into the data and seeing which themes were relevant to which groups. So down here below, you'll see our JAMA paper. It was the one that was all 13 focus groups, but then we had spin-off papers. Our ethnicity disease paper focused more so on establishing COVID-19 vaccine confidence in Black communities. Our Latino paper highlighted more a call of action in promoting equity to vaccine inclusion for Latinos, especially those enduring pandemic hardships. And then our Native American paper focused more on what decision-making factors went into Native Americans wanting to accept the vaccines. And then because we identified these different nuances across the racial and ethnic groups, we were able to also inform tailored outreach materials and translation for each of the racial and ethnic groups as well. So an advantage of doing our stratified group analysis was that we were able to get deep insight into the multi-ethnic groups. And diversity was a huge strength of this because we were not only able to identify community-specific methods, but also cultural ones as well. And so this strengthened our significance and impact and also allowed us to form policy recommendations that were unique to those specific racial and ethnic groups that we interviewed. Now, I do want to asterisk diversity here in that though our multi-ethnic focus groups were diverse, remember we had small sample sizes in each of these focus groups. So qualitative research in general can never be a full representation of what the total population thinks of something, but it did give us insight into some of the perspectives for these groups. And because we use the Braun and Clark 6-phase reflective thematic analysis that Savannah just talked about, we were able to share these population-specific analysis that was supported and stayed true to the data in which the participants shared with us, and doing so in a storytelling kind of way so that we didn't lose the participants' voice and perspective as we were sharing these results. However, challenges, as we all know, journals have tight word limits, so it was very hard to want to share all this data, but being told do so in 3,500 words or less. And we also wanted to make sure that we weren't making other people that read our papers make these implications or stereotypes about an entire group of people based off of just what we found from these groups in Los Angeles County. So it's important when you're making implications about your findings to remember that that's just representative of the people that you interviewed, but not representative of the nation of, say, the Black community in the United States or any other group that was interviewed. And it was a extreme challenge, but we did it to be able to find population specific papers that didn't restate the themes in our overall paper. So a way that we combat this is, say, for example, in our Black focus group paper, we made sure to highlight that these themes that we were presenting were Black specific considerations to build vaccine confidence and accessibility that weren't previously described in our larger multi-ethnic study. And we made sure to cite that study so that people didn't think we were self-plagiarizing, but kind of showing that we are building off of this larger study, but showing more of a group analysis focus. So, like I said, I'm not going to dive into these, but I just wanted to show you how the themes varied by paper. So, this was our JAMA paper in which we organized by the different vaccine hesitancy matrix. So, these were some of the contextual factors that came out. These were some of the individual and group influences that came out in terms of themes for decision making. And these were vaccine specific issues of concerns that the community had about what they thought about the vaccines in terms of their decision to get vaccinated. But then, as you can see here in our Black and African American paper, you see that some of those themes are different. And again, the focus here was to focus more on vaccine confidence. You can see where it's the same data, but we focused in a different purpose of the study. So we got different themes to reflect the specific groups. Same here with the Native American population in terms of the themes that came out for that paper. And lastly, for the Latino paper, more of the call to action. Here are some of the themes that came out. And I'm happy to answer questions at the end, and we share resources for these papers if you'd like to read more about them. But I think the coolest part about this is the community outreach. So, like I mentioned, we wanted to make sure that we weren't just coming into the communities and taking data from them, but actually giving something back. So we were able to use some of the myths that we heard from the and concerns as well from the focus group interviews to be able to address this in a frequently asked question sheet. So here in the boxes here, we heard lots of concerns about clinical trials not including people that look like me. And by looking like me, it included not only racial and ethnic identity, but were people with comorbidities that I have in these clinical trials too. So we made sure to show, at least for racial and ethnic makeup, that there were people from different groups included in these clinical trials. We also heard concerns and skepticism on why are they spotlighting communities of color? What about poor white people who need the vaccine as well? And so we also highlighted why it was important, why there was a spotlight on community of colors, particularly with the fact that it was the higher morbidity, also mortality rates from the COVID-19 infections, as well as they made up the most of the essential workers. So just highlighting the risk associated with COVID-19 for these communities. We also did events and local media. So a lot of our materials were informed again by the focus groups that we disseminated back into the community through town halls with the community partners that we have listed below. And again, a lot of the times they reached out to us saying, we need more information on this. And we were able to use that information from our focus groups to give back education. So as you see here, we have an American Indian Native American disparity slide because they wanted us to come talk about it. And that's Dr. Brown in the corner there doing that. We also disseminated our findings in local ethnic media articles like La Opinión and also the LA Sentinel. And these were able to highlight, again, those group specific findings that we found. And we also made community friendly materials as well to have as different outreach resources out in the community. And then in terms of policy, we were able to disseminate this as a policy brief across various sectors. And so with our policy brief, we were able to disseminate this to local, state, and national stakeholders to give them community insights and barriers to the outreach to getting the COVID-19 vaccine. And this was used to inform state stakeholders, LA County Public Health Department, and also inform development of outreach materials and education materials that they were able to do through their different sectors and facilities to reach out to the community as well. And then this was probably the coolest part of our focus groups. As I showed in the previous slide, one of these were the state initiatives went to the governor's office. And so from this policy brief, we were able to partner with the governor's office, along with UCLA and 34 other local community-based organizations to create the Get Out the Vaccine campaign or program in which we were seeking to reduce structural barriers to COVID-19 vaccine registration and facilitate vaccination through on-the-ground community outreach. And so we adopted the Get Out the Vote campaign, which uses canvassing political tactics to engage people to vote. But instead, we use these canvassing tactics of door-to-door knocking, phone banks and calls, and text messaging to register people for the COVID-19 vaccine. So we heard from our focus groups early on that there was concerns about people who can't come out their house, who are bedridden, who maybe are fearful of coming out because of weakened immune systems to actually go to vaccine sites. So this program was designed to bring the vaccine or at least the registration to you. Myself, Dr. Norris, and also Dr. Brown led some of the COVID-19 vaccine education training and messaging. And this was a way for us to make sure our canvassers and also our community-based organization leaders had the ever-evolving information on COVID-19 and also the social distancing practices and the changing COVID-19 vaccine information. We also acknowledge that because the pandemic created such hardships for many people in the community, that it was beyond just making sure we go to the community and promote this vaccine, but also seeing what else the community needed. So we also built in social services to be able to support the community. So that either meant connecting them to rental assistance programs or also helping people to get connected to the internet as well if they needed internet access. And a key hallmark of this program is that we hired people from the very communities that we sought to do outreach in. So many of our canvassers were teenagers or like 16 years old or older. Some were promotoras, but they were able to have a job program for unemployed and underemployed residents that were reflective of the communities that we were doing outreach, which we heard in our focus groups. Like, I want to see someone that looks like me that got this vaccine and see how they're doing with it. And this is just an example of some of the training sessions and outreach materials that we developed for the Get Out the Vaccine campaign. We were able to recreate a frequently asked question sheet in multiple languages. But I also want to highlight here is that we understand us being an academic institution may cause some mistrust. As I mentioned, there's this reputation. Researchers come and get what they need and leave and don't see them again. So we wanted to make sure that we were highlighting the CBOs here as well as we acknowledge that they were trusted messengers in the community. So we encourage them to put their logo here too, because seeing UCLA and that just made people more accepting to like, oh, I want to learn more about this information. And then as you can see in this slide here, we dispelled some of the myths that were coming out. So remember early on, I told you people were skeptical about the clinical trial skipping steps. So we acknowledged that here and gave a little more education with that as well. And with that, I thank everyone for your attention, all of our funders that supported this group, our community partners who we could not do this without, and the amazing team that I had the lovely opportunity to be a part of as a postdoctoral fellow. And we'll take your questions. Oh, here's our methods and then references, and these are to our actual papers if you want to read them more. Thank you.
Thank you, Lisa. I'm also going to highlight SERP services, in case there's any folks that are interested in, just because we might not get to all the questions or will, or you may not stay on, you're also welcome to contact us. We provide free services, including qualitative guidance. So I think the first question is Kristen Choi. She had a great question about engagement over Zoom and virtually, which I agree a lot of people are getting more immune to. You know, now that we have all this familiarity with Zoom and virtual engagement, we multitask or we're cooking dinner at the same time. So I completely agree. I don't have the answer, but I have some suggestions. I really think making questions very personal. People are more prone to talk about themselves or how they might interact, and or talk about their community. I think that that's a huge way to get at this. Sometimes smaller groups is more helpful because there's more pressure to speak or pay attention. I find that when people aren't paying attention, they also may say something that somebody else had already said or not, or just regurgitate what somebody else said. So sometimes as a moderator, I'll also kind of have checkpoints throughout, like, hey, we've heard this, this, and this. What else are we missing? And I'll do it in a voice, where people are paying attention. If somebody else has dragged on their answer, I might summarize and then kind of reflect back. So I welcome other strategies. I'm sure you have some too, Kristen, but those are some thoughts I have. I do think it's really being an active process. I also think having a sense of humor and being fun really does help a lot. Like in terms of motivating people to stay on a session. I also think paying people well is really important, especially for diverse groups. This was a 2021 and $100. And honestly, now if we were to redo the study, I'd probably argue for $200 per focus group or something. I think money really does help support engagement, especially diverse engagement. People are busy and have lots going on, and especially sharing sensitive subjects. And $100 at that time was actually really, really good. Like that was on the high end of focus groups. Yeah.
Yeah, thanks, Amanda. That's really helpful. Like I said, this has been a huge challenge, and I found that even in contexts where people are being paid well, sometimes it's still hard. I've kind
Mhm.
of taken the approach of like calling specific people out, like, hey, we haven't heard a
Yeah.
lot from Lisa. Like, Lisa, do you have any thoughts to add? But I always feel a little bad doing that because I feel that participation should be voluntary. But at the same time, if someone's consented and agreed and they're being paid and then they hop on a Zoom and say nothing, that's also hard. So, anyways, appreciate the thoughts, and if others have thoughts too,
I think
that'd
we
be
have
great.
to call on people. I
Yeah,
really think
yeah.
it's like so many of the research that I do with Dr. Brown and have done with Lisa are people that are not used to participating in research, and they are happy to slide under the radar and get paid or don't know if they should speak up. And I think buttering them up. Also, I really think, I mean, I call it buttering them up, but I really think it's like validating people and saying, "Oh, that's super important," or "Tell me more about that," or "Oh, that's really interesting." I really think providing active feedback that you're actively listening to them is so important. And I'm sure you're doing all these things. I'm just saying it for the room, but um, uh,
Yeah, or I think also maybe just sort of setting the expectations at the beginning, of like, okay, well, for this question, we'd like to hear from everybody on this, just so people kind of know and they have, because like you said, I don't think it's always that people aren't paying attention. It may be sometimes that it's just like a little awkward to know how to speak up on Zoom. And if you're a community member that isn't really involved in research and your work isn't on Zoom, it is kind of weird.
Yeah, and I think that is a really good point. I feel like there's often in focus group guides, there's probably two out of the 10 questions that are most important, and highlighting that for the group and saying, oh, we have three more questions, also giving them feedback of where we are in the time. But also, hey, this is one of our most important questions. We like you said, this is one of our most important questions. We really would like to hear from everyone on this because this can really give us ideas for how to change things. You've warmed them up at this point. They know what to expect. They know you're accepting of their thoughts. Which is half the battle of focus groups. So yeah, but this could be its own talk, I think. So great question, Kristen.
Yeah, for sure. Thanks.
Okay, Dr. Hayes, coming in with the reviewer questions for our papers. He's asking about saturation, inter-rater reliability. So 1 in 4, those are actually, Braun and Clark kind of actually discourage them just because they ask really good questions about the use of them. What do you mean by saturation? Do you mean thematic saturation? Do you mean coding saturation? Do you mean data saturation? Do you mean recruitment saturation? And recruitment saturation is really impossible in qualitative data. How can you account for all the perspectives in the world? But um, just that it is this concept that may not actually have a definition, because there might be something you can always find, and I think the goal is always to find the how are you being fair to all of your participants and all of the stories in the room in terms of saturation, and being truthful about your data, and doing that well, and sort of that quality improvement throughout your evolving understanding. And inter-rater reliability that may say, oh, Lisa and I are 80% spot on coding. But that doesn't mean we have a really good coding scheme. It doesn't mean that we've been really thoughtful. It might mean we have 20 codes that are all over the place that have, like, if I pull the quotes from one code, they may completely match with another code or be completely overlap or not really make sense as a standalone code. So I don't know, Dr. Hazen. I know I don't know what I know that there's also different opinions on all of these. So
Yeah,
Yeah,
Michael,
I would
you're
say like
absolutely.
for the inter-rater reliability, I mean, we didn't have a like percentage or a number to give, but anytime Savannah and I met with analysis and I probably coded the same block of text as something totally different, we will have those iterative meetings to talk about, okay, maybe I didn't call it politicization, I was calling it something else, like government influence, but we're tapping on the same concept. Through those different meetings and the communication we had, we were able to arrive at a code name or maybe a definition that fit what was being described. So in qualitative research, it may not be a number like in quantitative research, but I think having those meetings where you reach consensus are very important.
Yeah, so I just brought that up because a lot of times you do face that when you're trying to publish, and people, it's a hurdle. So they'll say
Mhm.
something about saturation, but it's not a dichotomous entity anyway. You know, it's kind of like you said, if you ask someone else, you might see something different, but you start to hear some of the same things, for example. So it looks like you're not getting a lot more information, but it's not an exact answer. And reliability, like you said, a lot of times it's sort of just a subset of coding and it doesn't represent everything else. But it's a thing that people face. So I just wanted to hear your response. Thank you.
Yeah, and in response to your question three, typically it depends on like your grant. You can keep like your transcripts for a while, but I know, for example, we usually write in our like IRB for qualitative research that like audio recordings would be deleted after we've like transcribed the text and checked for accuracy, or at the end of data complete our analysis. So that's just some of the things that we do. But transcripts we tend to keep for a little bit longer. I think we still even have ours, but they're like in a shared folder and no one else can have access to. So
Yeah, that's just another thing because that's the data. And you know how more and more now with quantitative data, you might share it even. So it just seems like there'll be more and more like you're going to have, in case somebody wants to look at it, a longer period of time, but I don't know what it is, you know.
Yeah, and then your question too on numbers, I think that's really important. I think it sometimes depends on how deep your questions are, how hard hitting they are, and how long your guide is too. I also think piloting your guide is really, really important with peers, when it's possible.
yeah, I would also add to like it depends on who you're interviewing. I find that in groups with like large numbers, that works really well with adolescents because they don't want to talk as it is. But if you have a group of peers talking, they're like more engaged.
Hmm.
Where when it's smaller, they're a little bit more timid. Like I'm not talking, this person could talk for me. So I guess it depends too on like who you're interviewing as well.
Yeah. The other thing I'll say that Lisa and I did is, for your first question too, is any of the focus groups that Lisa or I weren't a facilitator in, we also had second, like we'll review each other's work just to make sure, the ones we were more experts in, or the groups that, we particularly facilitated, we may have had different perspectives on than the ones that, you got to sit back or take notes. So we did some of that cross hatching. Yeah.
Right.
Um, Go ahead. Real live question, and then we can get to the other ones in the chat. Yeah. Go ahead.
Hi everyone, Savannah, Lisa, thank you so much for
Oh,
the.
hi, Louisa. Wait, who is that?
Oh,
Oh,
I'm
no, that's Addis. Okay, okay,
Addis.
okay. I saw
Um,
Louisa in the chat. Hi, Addis. Thank you.
Nice
Hi.
to see you guys. Thank you for a great presentation. Very quick question. How quickly do you start analyzing the data? Do you wait? Are you analyzing, finish one focus group, start analyzing right away, or do you wait after a certain number?
I think you need a good couple, especially from like diverse groups, because I think you can just get stuck in a rut and you can just get really, your first transcript or whatever can be such a favorite. That's your first baby, and then you come up with your themes, and then by the 10th transcript, you're getting completely different things, and it's thrown your whole coding scheme for a loop. Um, So, I mean, this was rapid, and so I think we did start a little bit earlier. I think we had some straggling focus groups, and we were in a crunch. But I don't really recommend it. I think it's better, or we do a better job if we have read all of the transcripts before starting the coding scheme. Yeah.
Okay.
Yeah,
Thank
I mean, it's not an arbitrary number, but I usually, like when I'm training research assistants, wait till we have like a good 5 transcripts just to see if we're starting to see some similarities. But even then, you still may be seeing new things that can go into your initial coding scheme. But I think waiting a little while till you have like probably half of your transcripts or interviews done would be a good time to start if you're not pressed for a rapid timeline like we were.
thank you.
Thank you, Addis.
Can I ask
Glad
a
to see you in
question?
the room. Yeah, please.
I'm Karen Wu. I'm one of the vascular surgeons here. We do a lot of qualitative work in my lab also, and so I have two questions. Actually, the comment that you just made about like doing a bunch of the interviews or the focus groups. I usually do individual interviews, but
Cool.
before you get into the coding is like the opposite of what I say
Mm,
and what we
mm.
do. We because what we do is our rationale is we want to like refine the interview guide if we need to
Yeah.
before we get too many done. So do you have a
Yeah,
comment?
I love that. So what I would do, or how I would justify that, is I would call those pilot interviews, like, and I would specifically say, oh, we have 2 pilot interviews and we want to improve the guide. I definitely think that this is why I never think you have a good guide, until you read it out loud to a room full of people. And so we really try to do a lot of practicing and then having it make sense. And then the flow is always off, or it's academic language. It's so different when you're writing versus talking and making it conversational. But I do think calling the first interview or 2 pilot and then revising your guide, um, but then those pilot interviews can also take a different place in analysis, because you may have asked different questions, or you may be asking the next group different questions, and so then you're labeling them as pilots, and then you may take more and more weight on them. I don't know if that rings a bell with you, but that's how I would typically treat that. I agree that the guide is always its own work in progress and its own job to refine, and Lisa and I did that throughout too. Like, oh, I think it would be worded better this way, even though the concept of our questions never changed. Um,
And can
but
I add one
yeah.
more? So the coding, we also code very differently. Like we do open coding and line by line coding, and we code, 6 or 8 of them, like
Mhm.
until we start seeing the codes sort of repeat themselves, and then we do make focus codes. Um, can you explain like how you chose between like your way, which was kind of sounded to me like you made a code book versus doing open coding.
Yeah, so I actually don't do line by line coding. I actually do quote coding, and I'm not sure that's actually a term. I actually really don't prefer, personally, like just coding one word or one sentence at a time. I feel like it often misses the context. And then when I'm going back to a code and I'm looking at the quotes in there, oh, I have to go back and read the whole transcript again to understand the context of that flow of what they're trying to say. So what I'll often do a thought, like basically their quote, like if participant one, the next 4 lines are from them, I'll start like just coding that whole section, even if there's 6 codes that match to that quote. Because then I have that context for when I'm building my manuscript, and I can quickly in Atlas click on that code. And I'm sorry, I can't show you this in real time, but I'm happy to meet with you to talk through how we do it. And we can compare notes if you find that interesting, or just to compare. Um, but it's much easier as I'm writing the manuscript to look at my codes, my code definitions, all the quotes, and then type up that narrative, because it's all there. I'm not looking at one word here or half of a sentence here. I'm seeing the total context. I'm understanding the flow of the conversation. That line by line encoding, and there is some like grounded theories people that like really believe in that. I feel like we can focus we can miss the bigger context, or like I struggle with that when that I originally thought that's what you had to do. So I do a much sort of bigger picture coding or passage coding, if that kind of makes sense.
Yeah, thank you.
Yeah. But yeah, I would love to hear more about what you do another day. Um, so Louisa, yes, we're happy to send you a bunch of stuff.
Okay.
Good to see you in the room.
Yeah. No, great presentation. This made me think that, a session where we help people to like how you code the data and how you go through it, right? Because I feel like you guys
Mhm.
were giving like really good background, right? But I feel like another more like technical session could be very helpful for a lot of people. And
Yeah.
then one thing after I see your presentation and the amazing work you did, I mean, you had so many focus groups, so many people, right? And it was a big team and so many resources, right? Um, Now I think is able to do a lot more, right? I mean, you did this back in 2020, right? 20. So now the world is so different. So I'm curious, maybe I know is Ron still here? I feel like Ron, maybe we can have a session on use of AI for qualitative research methods. I'm really curious to see if people are embracing that because it does seem that for people like me with limited resources, limited budgets, AI can make a big
Yeah.
difference.
No, I
So
think
any
there's
thoughts on
definitely,
that?
yeah, I think there's contexts where that's really can be really useful or rapid. I mean, I always kind of had a laugh to myself when Atlas TI came out with the word cloud function, because they would take all your transcripts and you could do a word cloud, but then like it would, every little tiny word, the top word would be something like moderator. And it just was like, okay, this is so not helpful. Like, this is not what they're actually talking about. Or, and it's taking in the moderator's account. Like, and there's some ways around that now, but, and they've much improved some AI stuff. I still feel like it's not there yet. I mean, it's not able to do the human side of what is the context that they're saying, and so many people, when you're speaking in a conversation, you're not speaking in a full sentence and you're kind of implying something, but like the words are there, or you haven't thought of all your answers, and so it's just imperfect language when you're in a real conversation. So I find that we're just not there when you're trying to get at deeper questions. I think there's definitely situations and scenarios where it can be helpful, especially when you're trying to do something rapid or implementation, um, or trying to do some mixed method thing, and you really just kind of want to get at what are people talking about the most, or what's most interesting to them or this group. I think there's situations. um, I would love to take a talk on that. I'm not the person to give that talk to, but what are the latest methods in AI and qualitative analysis would be fascinating. I don't know what they are, and I don't know how far they get you. Yeah.
Okay, I'll send an email to Ron about exploring that maybe for a seminar in the future because your presentation really made me think about where are we going, right? But no, thanks. Yeah, great, great, great presentation. Thank you.
Over time. Thanks so much to everybody. Thanks so much to our speakers. We're so grateful. And then we'll reach out again about a follow-up session.
That sounds great. Yeah, we do. We're happy to. A lot of the methods talks I give are actually typically one-on-one, but and Lisa and I can come together and give one too again. I'd love to bring Lisa back when she has time, but yeah, happy to be of service. As part of SERP or any of these. Yeah, cool, interesting, Kristen. Cool. I'm gonna open those now.
Also, please fill out the evaluation. That helps us out a lot, and we can share with our speakers as well.
Fantastic stuff. Great to
Thank
see
you all.
Thank you. Thanks for
Thank you,
having us.
everyone.
Yeah.
Have a good one.
Bye.
Bye.